Hello, everyone. Welcome to our Lunch and Learn broadcast today. Thank you for joining us for Pediatric Solutions for a less hectic flu season. We know this is an incredibly busy time for all of the offices, not just flu, but back to school and kids sharing all sorts of germs with one another, as well as you guys trying to fit in all those fantastic well visits into your schedule. So we're going to walk through a bit today. This is going to be recorded, so you'll be able to refer back. I know some people are still joining because we are right at time to start, but I want to honor those of you that made it on time, and anyone else, feel free to go back and you can get the recording. My name is Rebecca Schaad. I have been working in the pediatric space for a long time, since 2007. I am really passionate about helping practices find solutions. We want to make sure that you're able to engage effectively with your communities, able to reach your families in multiple channels so that they're getting really great information, as well as being able to attract new patients because they know that you offer the solutions that their families really need at this time. So we're going to walk through some of that today. Happy to be here with you. Feel free to reach out at any time. My contact information will be at the end of this as well, but happy to meet with anyone that is online today or has questions. So today, what we are going to go over and cover, we're going to look at the answering service. What are some solutions for answering your phone lines? We do offer an answering service that's pretty phenomenal. We can answer calls 24/7. So that means whether you have overflow daytime calls or lunch and after hours issues, we're there for you. We'll go over what some of those solutions look like. We also want to make sure that your parents and patients are able to get the information they need, but also the visits that would be really helpful to them during different times. And with that, we offer the telehealth solution that we're going to look at how are pediatric practices effectively using telehealth today versus maybe right after the pandemic. That has changed. So we'll share those new stats with you today and what that looks like. Also taking a peek at your current website. What information do you leverage on your website? Are you offering really information on medicine dosages, immunizations, things your families need right now, as well as alerts? I think right now with the hurricanes coming through, we've had power outages throughout the country, other things that may disrupt coming into the winter season with inclement weather, changes to schedules. How are you taking care of getting that message out to your current parents and families to make sure they're well informed in a timely manner? What are you doing there? So we're going to take a look at a bunch of that today. The first thing we want to do, though, is ask a question. I am going to launch a quick poll. We're just going to take a few minutes to answer this question. Have you called your office during office hours and after hours to follow through your phone tree options? Yes or no? If you could just fill that out for me real quick, it helps me to know where your office is at and what you're currently doing. We'll take a few more moments as we're getting these responses coming in. I list both during office hours and after because often those are two different messages in your phone tree, and we want to make sure that you've had a chance to go through both. Just 3 more seconds for anyone else that wants to answer that. Okay. So we're going to close that, and I will show you the results that we have here. So we have 70% of you. That is a fantastic number. You are listening to what you're saying to your patients. You've walked through it, and 30% have not had a chance to do that yet. I highly encourage you to take a moment to do that. So coming back into, let me go back into slideshow. So we want to look at some solutions. This is, I believe, going to be really helpful during this busy flu season time at managing all of those calls that are coming through. We know call volume will go up dramatically during the fall, mattering when the flu season hits. If it's an early flu or a little bit later, those calls are going to go up. You're also still trying to handle all of the normal appointments from your well visits, immunizations, and also we're going to be coming up on RSV. Lots happening in those offices, but some things that I hope would be able to help you as you walk through navigating your daytime hours. So as we look at this first, always keeping in mind whoever answers your phone is definitely representing your practice. Treat that front office well. They are the first look and touch, the warm touch from your office out to those families. Are they answering with a smile as they pick up those lines? As hectic as it can be while they're on with those parents or families, that they're fully engaged right then with that family, taking care of whatever issue it is. What I like to say is definitely work with your front office to ask, what are those top 3 to 5 phone calls they're getting? A lot of times it's going to be the same throughout the year. Hey, they're calling about how to schedule an appointment, but it's also seasonal. I would venture to guess right now a lot of the calls coming through are going to be around flu. Do you have flu clinics? Are the flu shots in? Do I just get that shot at my well visit? Do I come in at a different time? Can parents get their shot with the kiddos? Do you have to be a parent or a patient in the practice to get a shot there? Lots of questions coming your way. So whatever those top 3 to 5 questions are, when you open your website up, and you should be visiting your website on a daily basis so that you know as an end user the information that's available there, what's important. Are you highlighting what's important? With those top 3 to 5 questions, when you look at it, are all of those being answered in the header of your website? So if they're asking, how do I pay my bill? Do you have a button for pay your bill online? Quick access, you're telling them right there, here's the answer. So it could be in a button. You could have a button on your website just for our flu clinics, and then it takes them to a page that lists out all the flu clinics you have in the office this fall. An alert, is that popping up to give them critical information that you want them to have? So again, we're just looking at that resource. Any questions coming through, how can those best be answered? Self-serve. We love parents that can self-serve through the website, but you have to offer them that info. When you do listen to your own phone tree, how do you want your parents to act? Where do you want them to go for information? So you have a lot of options here. Most phone systems, they're going to give you the option to have daytime messages. You could have a separate lunchtime message, one for after hours. So listen to all of those options, even holiday messages, putting those in there. With the overflow of calls, if you're seeing, they're getting a busy signal, that happens to some of my offices, or they're going to voicemail because nobody can pick up, that's a point of frustration for your families. So instead of having them live in frustration, let's offer some other solutions. One is overflow calls that come in. We do have live agents that are all based in the US, and we can take those calls for you. We can manage those calls. We can send them in via fax. We have a live call history that comes up, and anyone you want to have access into that call history can go in the back end, see the calls that have come through, and they can even listen to the message themselves if they want to before reaching back out to that family. People do love talking to a live person. If they've made that phone call, that's how they chose to reach out. None of us like to just be on hold. But while they're on hold, use that time effectively. That is when you should be doing some announcements, alerts, bringing just to the front any information you want them to have, like the flu clinics you're going to have this fall, best ways to schedule appointments, do you have walk-in clinics? Give them that info while they're on hold. If you have a new provider, a new location, a new service you're offering, meet and greets, give them that information as well while they're sitting on hold. One of the main reasons people call is for appointments. So to make sure that anyone calling for an appointment gets to a live person, you could route those in your phone tree, that anyone calling to make a same-day appointment gets sent to someone within office. They can take care of that. If there are certain call types that don't need to be answered emergently, you could instead send those overflow calls if they click a certain button. Instead, that would come to the answering service. They still get a live person, but that message would be sent to you that your staff can handle and take care of as they have time throughout the day. Slightly different, how do you handle after hours? We call after hours anything from lunch to whenever the office is closed. If you close for provider meetings, a retreat, for anything, why would your office be closed? How will you handle those messages? So a couple of things I want to point out here. One is if we have providers on the phone or people running the office, you know, pediatricians give away a ton of free advice. It's great. It builds connection. It builds that relationship foundation that the provider is there to listen and to give that advice. But in this day and age, there's a solution. Instead of just giving away free advice, we highly recommend turning the visits that can be used for telehealth, turn it into a billable encounter and a true telehealth visit. We'll show you what that can look like. I put this on there. I know it's a lot of words, but under the free advice, you will see if your providers can change even one telehealth call after hours into a telehealth visit, they are going to get between $30,000 and $40,000 in revenue a year. So you can see as that builds up, it can really increase the encounters that you have. And then you also have those records you can upload into your EHR so that you have that record. And a lot of great things can be answered via telehealth. Again, listen to your after hours phone tree. It should be different. When they're calling for your after hours message, you might say, "Thank you for calling Pikes Peak Pediatrics. We are currently closed. If this is an emergency, please hang up and dial 911. That's important. You have to say that in the beginning of your message. I would add this for frequently asked questions. Please go to our website, pikespeakpediatrics.com, where you will see medicine dosages, immunization schedule, how to request medical records, whatever things you want that are common questions, list them out there so they know that's the best way. And then if you have our digital online solution, I would add, for the quickest way to reach the on-call provider, click the top right button wherever you put it on your website, Remedy Messenger, and the on-call provider will get back with you as quickly as possible. So that gives another option for them to reach out. We have both live agent and digital option with that button. I love the digital option because it costs the practice less than half of what a live agent call will cost. So the cost is much less. A lot of parents and patients don't want to pick up the phone. That's why mobile apps for ordering phone and not having to have contact have gotten so popular with those in their 20s and 30s. So if they can reach out to the provider and just state for themselves what's going on with their child, that is really attractive to them. Within that, just know that all registrations to reach out via this digital method are free. There's no charge for your patients or parents to sign up. It's just when they use it, there is a flat rate per message that goes through. Super affordable. You decide when the button is live on the site, and you decide when it's hidden. I do have practices that have that up 24/7, others just during lunch and after hours. I want to ask another quick question here. 1 second. Okay, next question for you. This is really helpful for me to see the results as well. Have you or your providers ever turned an after-hours call into a telehealth visit? Yes, no, or I didn't even know I could do that. I'll give you just a 30 seconds or so to answer this. I appreciate the input. Just a couple more seconds for you. Okay, I'm going to share the results with you now. So we have 56%, that's a little over half, fantastic. They are doing this. You guys are using that option, which is great. But 44% of you are really missing out on not only revenue, but making the lives of your families easier. There are times it is really hard for families to take off from work or to pull a child out of school again, especially things that happen a lot, med rechecks, or if you're doing weight management, things like that, where they're pulled out again and again. They don't want to lose school time for that. So let's talk briefly about some solutions we have here that, again, are going to help you in the flu season as you walk through and can offer these solutions to your families. I thought this was interesting. We were looking at stats for how telehealth has been used and how it is going to be used, how it is now being used, and their studies for the future as well. So at the end of the pandemic, I mean, totally makes sense. Most practices were using telehealth for mental health consults and visits. Very appropriate during that time. It was actually fantastic that kids could get the help they needed when they really were at a really hard time during the pandemic. In the last 4 months, it's pretty awesome. We've been working on a study and collaborating with the Children's Hospital of Philadelphia and some FQHCs to get some really great data on the difference now. So even though mental health was the top reason at the pandemic time, that has changed. In the last 4 months, the newest stats are the top reasons people do telehealth are weight management. Also, mental health still up there, especially those med rechecks, can very easily and quickly be done during telehealth, making life easier for parents and patients. And then URIs, or upper respiratory infections, and pink eye were in the top as well. What's great about that is very quickly, after hours, that parent or patient can get antibiotics or what they need so that their child can go back to school or just feel better right away. They don't want them suffering until they can get that appointment in office. As they continue to study the best ways to integrate telemedicine into primary pediatric care to ensure these positive patient outcomes, we'll keep you posted. We know some of this may change, but for right now, this is pretty solid information on why telehealth is used and where it's effective for your parents and patients. one of the solutions we have here, telehealth works hand in hand with our answering service. They use the same secure mobile app for this information. So within the app, when a message comes in, I do love this. If the provider's busy, they didn't hear it ping them that they have a secure message, we will text and say you have a secure message. There is no PHI in that text message, and the mobile app is HIPAA compliant. You can get in with facial recognition. If you don't have that, we can do a PIN and set that up as well. But there's multi-factor authentication to get in, and now there's no worry of exposure of PHI because it is hidden here in this mobile app. When they pull up the mobile app, what I love are the options that it gives our providers right away. So one of the top options when they're looking at the message that has come through is this button, just call back. So they can click it right there. They're going to call and it blocks their phone number. I don't think any provider wants their phone number out there necessarily unless you're a concierge practice and choose to do that. But most providers, you have a family too. You have a life after hours, and this is giving you that ability to still block your number and meet that need. You can show your number with that second option below if you want to. But my favorite right here, you can schedule that televisit. You can schedule it to start right now. And so within that televisit, you actually are just going to put down basic information, patient name, date of birth. We do need a phone number because we're going to text that out, and you can invite multiple people to that visit. So if kiddo, is not in the same home as mom and dad or parents or guardians, you can send that out to multiple people and they can all join the televisit together. You can also remove people from that televisit if you choose to do that. Options within the telehealth, you can do progress notes in there. You can do CPT codes and ICD-9 codes. If you choose to just use it for the video connection, you can pull up your EHR and take notes directly in there as well. Lots of options. When the parent or patient, if you click schedule televisit now, they'll receive a text message that takes them to a waiting room. There in the waiting room, you decide the questions you want to ask. It can be just a few, name, date of birth, things like that. But you can ask for medication history. You probably want to know why they're meeting for the telehealth visit. They can upload their insurance card front and back. They can make a payment right then as well. As soon as they've answered the questions and consented to the telehealth visit, they will wait for the provider to join. And in that space, even in the waiting room where they're filling out the questions, a staff member can jump in, they can chat back and forth with any questions that are there, and then you can start that telehealth visit. Nothing is charged. We charge a per minute, but that doesn't start until the provider has joined the patient on that call. So while they're filling out and doing everything in the waiting room, there's no charges there. The minutes start just when the actual call is taking place. Lots of great options there. If you want to learn more about our telehealth option and how it can integrate directly with the answering service, we would love to answer that for you and give you information there. Last question for you guys today. Again, this just helps me to know what to hit on by how you answer. So the last question is, can you update your current website? Can you add alerts, change your content on the fly? Yes or no? Give you just a few seconds more to answer this, about 30 seconds, and then we'll jump into the last part of this, and I'm going to show you some live website examples from here. few more seconds for you guys as we collect the information. Okay, I'm going to share these results. This makes me really happy. 88% of you have said that you can go in, add alerts, change content. That is so key. If there is a reason you can't go in, or you don't know how, or you haven't been trained on your current website platform, it's pretty important. Things change quickly in our world. We know that. We want to be able to tell people, you know, our phone lines are down, but our office is still open, or there are different things going on in the community you want to bring attention to. We want to have that option. I'm going to show you a few examples of how our different websites we've built, how we've done this, and I think have been effective in their communities. So here's one. Here they can pop up alerts as they want. So really great. They can go right in, schedule that flu shot here, but love that they're able to quickly communicate and see that alert pop up. Here's another practice. They did it a little differently. They wanted to highlight the flu vaccines coming into the office, so they have the alert here. This practice has also done a great job of having practice news updates. So they want to keep their parents and patients informed of what's going on in the practice. They've added topics and pictures so that they can have this great information and keep it throughout the year. Again, a lot of times there's things that are seasonal that you are going to list throughout your website, and there's times you may hide something, like flu clinics are going to happen every year in the fall. So you can do a practice news item talking about flu clinics and then hide it until the following year, and then quickly just update that information so it's fresh for what's happening that year for your practice. This practice has it on their homepage. So when you scroll down, they have some latest practice news. I love what they've done here. This is great for flu. How can we make it easy and less hectic for our parents and families? So they have a drive-through. I know we saw this a ton during the pandemic with COVID shot drive-throughs, flu shot drive-throughs. It's still super effective. So here you can see they've done this. They did make a post so it quickly can be added to Instagram, Facebook. Meet all of your people where they live, whether that's social media or here on your website. We want to make sure they have that great information at their fingertips. So if you're not doing a drive-through flu clinic, look at some practices that are. I think this has been super effective. And again, you can edit the back end of any of our websites super easily. Just one more option showing you. This is another practice. They use a lot of the practice news items to keep their people up to date. Here on their flu clinic info, they've also attached different forms. You know, they always have to fill out those forms when they come in. For flu, they can do it ahead of time or have it ready to go and bring it with them, which I think is a great idea. If you have not used the flu toolkit from the AAP, we can give you this link as well, or you can just go to the flu toolkit for the AAP at healthychildren.org. Great information. What they've done here is they have posts out of the box ready to go for you. You can put videos on your social media. They also have posters. They have Canva ready to go, so you can put these posts on other social media channels, but really fantastic that they have promotional resources for you for your office, and then you brand them. You can put your logo, always direct them back to your website as much as possible. When you do any social post, we direct back to the website for that. I know we're coming up on time. I just wanted to share one more thing, medical resources. So medical is huge. When people are deciding where to get good medical information, it should live on your website. So here we do give the option of immunization schedule. This practice edited the schedule so it fits what their practice does. So all of that is editable. A really big one is medicine dosages. I love this. If I go in, a lot of the content here comes directly from the AAP. But within that content, you can edit your medicine dosage tables. So this practice, they added the word Tylenol. You can leave teaspoons, take them off. I have practices that do that. Really great though. Over 70% of your parents and patients will reach you on their cell phone. So here it's no longer a table, it is mobile responsive as a solution. And we can add medical content to any website if you don't have our site that offers this for you. And then we have Is Your Child Sick by Dr. Bart Schmidt. So you're directing your parents again to great content. If you use this for triage after hours, what's great is the content on your website will be complimentary, written about a 6th grade level. So your parents have the same info 24 hours a day on your website that they're going to get through any triage as well. We have the alphabetical articles as well as the symptom checker to bring them in, and they can pull up the articles this way. Dr. Bart Schmidt will always offer additional articles that might make more sense. Then it'll be broken down into what is emergent, what can I do with my doctor's office, and what can I do at home. So this content is really usable and friendly. And lastly, you have the AAP library. So here within the content, you can add to any of these sections if you have a lactation consultant or somebody here that wants to add articles. But on top of that, you can hide anything you don't agree with, but all of this content stays on your website, which is really fantastic. So here, if I click something, it shows it's from the AAP, but I didn't go anywhere. I know we're at time. I'm going to see if there are questions. I think I forgot to say you can drop questions into the panel, but we'll stay and answer any questions that were here. Thank you for your time.
Hi, Rebecca. Thanks for sharing the great information with the audience today. We did have 2 questions come in already, so I think people did know how to use the questions box. The first one is, it's 2-part. So it's a 2-part question. The question is, for overflow calls, can we choose the hours we want it turned on during the day, or must it be on all day? And then part 2 of that question is, if we choose the hours, how much advance notice do you need if we realize that we need additional help during the day?
Great questions. You manually send your phone lines to us. So yes, you choose when you want us to take those phone lines. Just send them on over when you want us to. It's great if you want to send us a quick email and say, hey, overloaded, we're sending calls. We'll also just know that because we'll start receiving your calls. So we are ready. I know Mondays are a big one. So we'll have extra staff. We know Monday mornings because a lot of offices are overwhelmed and we take a lot of overflow on that morning. But yes, you can do it whenever you want. Always appreciate if you just let us know so we know, is there a reason? Are your phone lines down? Is something going on? Or is it truly just overflow?
Thank you. And then the last question that we have, Rebecca, is I have a website. How do I buy just the medical content package?
Fantastic. There is a survey that's going to go out right after. Just mark that you want information. You can also email. If you're with Office Practicum, you can email your account manager or reach out, but you will have contact information. So we will know, and we would be happy to add that content for you.
Okay. And I don't see any other questions that have come in, Rebecca, so I think that wraps up the Q&A for today.
Awesome. Thank you, everyone, for your time, and I hope you have a less hectic flu season. Take care.